Attention! If you ever needed proof that gender-affirming care was harming children, please stick around for the 4:44 seconds this was accidentally recorded at. And if you are at all awake and know that 444 resonates with you as per synchronicity, then stick around.
Educate you on something that you probably don't know.
Hey Nancy, how you doing?
Boy, do I love it when they say, "Do not record me," but they're in a public area. Makes me want to record you even more.
We do not consent to being recorded.
Oh, I'm sorry. Trans rights.
If trans rights are human rights, then wouldn't that be one and the same? I think people are misconstruing, because I've heard several different arguments from different sides saying that they think that they are making it aware that they are one and the same, or that they're trying to raise awareness that one is still visible and exists, when I don't feel like I don't exist. Because hello, I'm right here.
And doctors, not legislators. The problem is they blackmail parents. They tell them their kids are going to commit suicide if they...
Dr. Hine, can you just share, why did you decide to speak out against gender reassignment practices at Texas Children's Hospital?
The reason is because I understand and I've seen the effects of what these blockers do, what these hormones do, and what these surgeries do. They are destroying the lives of these children. They are putting them down a road where they become a chronic medical patient.
Dear anyone that has doubted me when I said gender-affirming care for children is not the way to go. Sincerely, fuck you.
That they can never come back from. And especially the surgical complications. I see these things all the time. We're talking about urethral stenosis, where you can't go out to a coffee shop and go to the bathroom because the urethra is narrowed. So that fluid builds up in the bladder, right? It's talking about fistulas, where stool from the rectum can pour into the wound that they call the neovagina. A lot of them don't see these problems in the first couple of months, even the first couple of years. But this is what happens. Right? And understanding that when I was at TCH, we would take children to the operating room, right? And we would make them better. But in the same operating room, they were taking them there and making them sick. They were putting them down a road that they could never come back from. So could I call myself a doctor if I didn't speak up against it? If they're going to mutilate and sterilize these children, someone has to speak up for those kids.
Well, while some on the other side may argue that pursuing so-called gender-affirming care is up to a child and his or her parents, I do believe it's the role of the government to protect children from child abuse. So let me ask you this, Dr. Hine. Do you think the government has a responsibility to protect children from these practices?
I do, especially when doctors and medical associations are deceiving parents and children about what exactly they're doing. They say this is evidence-based. That's a bogus statement. All the evidence they have is completely fraudulent. The way the studies are designed are meant to provide them a certain result. This is what we call fraudulent science. These are fraudulent studies.
Anyone with the rare ability to critically think can definitely surmise or assume that this probably would not be only to this type of fraudulent study. I wonder how many other ones are.
When the doctors who are informing these parents are misinformed about the pathology that they're treating, that's not informed consent.
If you made it this far, I really appreciate your time. And what do you think? I mean, because this seems like very compelling evidence against, something that I've been kind of against. But lastly, I want to make a restatement again. This does not mean that trans kids do not exist. They do, just very far, few, and between the amount of individuals that are that self-realized. It's really that is such a big decision for a child to make on their own doing, without any outside influence, without any causality, without any other external force that pushes them towards that decision, kind of like how mine went. Very rare. But mental illness is a trend. And it gets trendy. Whether you want to agree with me or not, it's fucking true. But I would love and appreciate your feedback. I love you.